A very good morning to you and welcome to K24 this morning as we begin our conversation. Starting off, let's look at what our newspapers have to offer in terms of news and what is trending and what is making headlines. Starting with which? People Daily. Governors call for new shutdown. That is what is going to be discussed on Wednesday if the president does convene the special extraordinary meeting that he'll be having with the governors and a section of the government as well to discuss the evolution of the disease that is COVID-19 ravaging across the globe. Now, also on the same People Daily, we do see that senators tell the DPP to act on 60 graft cases. And the very top there, you will see that MPs are split on the BBI county bosses' fault plan on revenue sharing. But the main focus here is on the coronavirus, where it says that on the day the country surpasses the 1,000 mark for COVID-related deaths, the county bosses seek tougher measures to rein in on the virus. Now, the leaders want bars closed, the curfew to begin at 7 p.m. and political rallies banned. That story is on page 4 of your People Daily. Grab a copy. Speaking of which, you can dial star 550 star 4 hash and get it for only 10 shillings. That is star 550 star 4 hash and get your People Daily for only 10 shillings and you will get all the stories that it has to offer. Moving on to the next one. This is the Daily Nation. Now, the big BBI split, that is what is on the Nation front page. That is the headline. Revealed Kenyans pay billions in COVID-19 hospital bills as well. A story of much interest, and that is what is setting the tone for today's discussion right here on K24 this morning. And on the top page there, you will see that on page 20 it says the U.S. votes tomorrow. American states brace themselves for post-election violence across Washington. If you've been following these stories on social media, Washington, the capital, is actually preparing for a very rough election period. You will get that on page 20. And on the back page, 18,000 teachers to go for the CBC training. Get that and more on the Daily Nation. Moving on to the Standard newspaper, Ruto left out of BBI power talks. That is the headline on the Standard newspaper. You will get that page, that story rather, on the page 6 of your Standard newspaper if you do grab that copy. And on page 11 at the top there, you will see that the Anglican Church turns 50 as COVID-19 surges. That is also setting the tone for our conversation for today, and how Africans lost billions in crowd one scam. If you are one of them, let us know what you think. Indeed, we'll be having that discussion later on. And if you check out the Star newspaper, it says that the stage is set for divisive BBI campaigns. Page 4 to 5, that is what is the headline on the Star newspaper. Another story there, former gangster now winning souls for God in prison. Page 9 of the Star, you'll get that story there. And 4 MPs travel to the U.S. to observe Trump-Biden presidential election. Page 6, as we gear for our very own election in 2022. But on page 7 as well on the Star, Uhuru's dilemma to reintroduce corona lockdown or not. Page 7 again, setting the tone for our discussion today. As we say, let us know your thoughts. The numbers are right there on your screen. K24 this morning starts right now. All right, welcome back. This is K24 this morning. I'm sitting in for Jeff Mote, who has to attend to other issues. However, we shall still have this conversation. And our panel for today is none other than Sylvia Kasanga, the nominated senator and chair Senate Ad Hoc Committee on COVID-19, joining us via Skype all the way in Naivasha. Karibu tena sana mheshimiwa. All right, she will be joining us shortly. We also have Zach Kinothia, the CAS Ministry of Education. Welcome very much, Mheshimiwa, as well. And we have Stephen Mwekese, who is already in studio, who is a public policy analyst. Karibu tena sana. Our topic today is the rising COVID-19 surge, the curve, as we like to call it. We've been saying for a while that it will be flattened. At one point, actually, it did seem that it was flattening. But let me just get it from you, Stephen. From your perspective, where did the rain start beating us? Because if you're looking at the numbers right now, they are not pretty at all.
Well, I could say that this started the moment we began to see a downward trajectory in terms of the COVID cases being reported every day. And the president was right by the time that he convened the session where the National Conference on COVID-19 in September. And from the discussions that were going on, it seemed that it would be okay to begin to relax some of the measures that were there. We saw an extension of the curfew time going up to till 11 p.m., reopening of bars and things like that, and the increasing of numbers in funerals and in church gatherings. But I don't think Kenyans understood that this was dependent on how best we as a people carry ourselves during this particular pandemic. And it involved making sure that we stick to the guidelines and the measures that were put in place to safeguard us against the surge of the second wave. But now here we are. We've been seeing that from the numbers alone, and in this 1 month that we've had the relaxation of these measures, there's been the highest number of recorded deaths within this whole period of the pandemic. And this prompted the president to now seek to convene an extraordinary session that convenes on Wednesday, in which they would relook at whether the measures that have been in place and the controls that have been in place, whether they've been followed, whether the protocols that were given to Kenyans were followed by them, are they still adhering to the measures? And this is the situation we find ourselves in. But what's troubling is that during this period, we've seen a laxity on the part of enforcement agencies. We've seen that Kenyans are walking around without masks. We're seeing social gatherings, there's no social distance. We're seeing that there's some wanton disregard of the measures that were already put in place. Political rallies are all over the place. We are seeing a number of people also taking casually the requirement that when you see some symptoms, you're meant to at least report. So we're having people just falling off. And these are the things that we need to now rethink and ask, are Kenyans taking this seriously as they should? And I believe that this is what will be evaluated on Wednesday, and we should expect the president to come up with some measures come Wednesday afternoon.
All right, allow me to bring in the audience onto this particular discussion by interacting with us on our question of the day. Is a second national lockdown the solution to the rising cases of COVID-19? Is a second national lockdown the solution to the rising cases of COVID-19? Let us know via our Facebook, Twitter, and our WhatsApp number, which is right there on your screen. Let us know what you think in regards to that one, so that we can get this conversation going ahead of this special extraordinary session that is going to be held by the president come, Wednesday. I don't know. Do we have Mheshimiwa? All right. We'll be having the Mheshimiwas joining us shortly. But let me come back to you again, Stephen. In regards to what you've just said, we are calling this one an extraordinary. You just mentioned right now we had one in September. Was it also extraordinary, or is this just a term that they use to describe these kinds of meetings?
No, the September one was a national conference on COVID-19. It was well televised. It was done live. There were inputs from experts and the Council of Governors and people from the ministry. And that really helped to really evaluate as a nation and hold a national discourse on where we are and the measures that we've taken. And we lauded ourselves for having taken all the right measures, and the numbers were declining and it looked good. But then after that, the president then felt, after consulting, that we should at least relax some of the measures. But he did put a caveat, and it was very clear that in the event that the nation does not take these measures seriously, we will go back into lockdown. And so by the fact that if you can read the press statement that was issued by State House recalling for this extraordinary summit, one of the key reasons that was given was that the high number of cases reported and the deaths reported in the month of October alone has caused a sense of alarm to the point whereby we would need to have an extraordinary summit that discusses what are the measures that have been taken, have they been followed, do we need to take additional measures to tame down the numbers and keep it low. And so that's what
allow me just to bring in the Senator on this one. Senator Kasanga, if you can hear me, I was just asking Stephen here in regards to the situation that we're facing right now, the surge in the cases of corona. Where exactly did the rain start beating us, considering that you are the Senate chair in the ad hoc committee for COVID-19?
Paul, will you allow me first to introduce myself? It's my first time on K24, and I really appreciate this invitation to speak to Kenyans. Yes. So my name is Sylvia Kasanga. I'm nominated senator in Senate, and I've been nominated by the Wiper Democratic Movement. My party leader, His Excellency Kalonzo Musyoka.
All right.
And thank you again. I serve Kenyans in different capacities in Senate. I serve in the Committee of Lands and Natural Resources. I serve in the Transport and Infrastructure Committee.
Right.
And as well as the Powers and Privileges Committee. And then lastly, of course, my fellow members in the ad hoc committee felt that I was able to chair once our former chair had stepped down.
All right.
And it has been such a privilege chairing the ad hoc committee on COVID. I've really learned a lot, and we've had a good time also engaging with government. Well, not a good time, but why I say a good time is because sometimes with government, we have to really push to get things done to our way, or trying to push for the interest of Kenyans. And in this committee, we're able to see actually a lot of things come to light, a lot of push that we gave the government at the time when the committee had started. At the onset of our engagement, we saw a lot of good things happening between Parliament and the executive when it came to issues of COVID management. But as you know, that our committee is actually coming to an end. We had a 6-month mandate. And actually this, as we resume Senate now from recess, we shall be winding up and giving our exit report, because all the other standing committees are now seized of the issues and they will be taking them up. In fact, as we speak, the health issues, we've already actually handed them over back to the health committee. Education issues are already seized with the education committee. So we are left with a few other thematic areas to do with financial issues, social and public order, that we are in the process of now winding up as part of our exit report. But yes, where did the rain start beating us? Just to answer your question, Paul.
Okay.
It's really unfortunate. It's really unfortunate that Kenyans have not really fully understood what the whole flattening of the curve means. And what the government was trying to achieve with the early lockdowns was, of course, to slow down the infection rate amongst Kenyans so that we can give time to our healthcare to be able to pick up and strengthen the infrastructure along the way, so that should there be a huge surge, then we shall be able to handle the cases as they come.
Right.
And the government was under pressure to open up the lockdowns, and that is again because of our economy. Our economy is very, very, very weak as we speak, and a lot of Kenyans have really, really suffered in the process of the lockdowns. And as you know, our economy was already doing poorly even before COVID. So COVID seemed now to put the icing on the cake when it came to issues of economy. So the government was under pressure. It was now becoming issues of livelihood versus life itself, and they had to make that critical decision and open up and tell Kenyans now to take personal responsibility. I think you've heard the president repeatedly, when he's addressing Kenyans, talk about personal responsibility. The chair of the National Response Team, who is the CS of Health, Mutai Kagwe, has said it over and over again, issues of personal responsibility. But you can see personal responsibility thrown caution into the air. Kenyans are out there. People don't care. And, it's a bit sad. And I have not minced my words when it comes to the political class, because we are out there calling Kenyans, paying youths and telling them to come out to rallies. We are not even saying, no, keep social distance, or at least trying to make sure that we are, as politicians, ensuring that the crowds that we call, at least we follow some level of protocol, at least wear the masks. At least wash your hands, at least keep a bit of social distance. Don't go hugging, everyone around. But you can see from the political rallies that are happening, there's no caution whatsoever. And now the government, in fact, this is where I'm hoping there's a government official in the panel today. Because what is stopping the government right now from saying, we are now going to start, taking some action on politicians who call these public rallies? Because it's truly irresponsible. Our politicians will have the capacity and the financial muscle to go for treatment should they get COVID. How about the Kenyans? How about the Kenyans? And as we speak, we know, and I can tell you without a doubt, when the Ministry of Health brought their task, they had a task force that went round checking on the capacity of the hospitals. And they brought us a report in Senate at the ad hoc committee. And a lot of the counties are not ready. In fact, the rating is not even at 60%. We are mostly like at 40%, the counties that are absolutely ready and prepared to deal with COVID. So we have a situation.
Interject you there in regards to the preparedness, and allow me to introduce again, like I said, the CAS of Education, that is Mr. Zach Kinothia. Welcome to the show, sir.
Thank you very much and good morning.
And good morning to you.
Good morning to the senator up there.
Yes.
And good morning to my brother here.
Yes, Mr. Sivid. Yeah. Now, she has just mentioned about the preparedness of the counties in regards to COVID-19. Now, let's talk about the Ministry of Education and, how we are prepared in terms of the schools. We just saw a few days ago, Tononoka in Mombasa had to, shut down. Star of the Sea as well also had to do something similar. Probably other reports that haven't reached us are also probably looking at a similar kind of scenario. What is the Ministry of Education doing in regards to these surges, especially in the schools?
Thank you. And from the onset, we have always insisted that opening of schools is based on nothing else but the safety of our children. From the very beginning, we have no other interest vested whatsoever in anything except that our children will be safe.
Right.
And that is, if they are at home, they must be safe. If they are in school, they must be safe. So we realized when we are reopening that our children were neither in school, neither were they at home. So where were they? And were they safe? I have had a senator rightly put it that some of the people in government are openly flouting the rules and regulations of public meetings.
True.
And we realized majority of the people who are following, the people who are doing public meetings are our children, not necessarily adults. People can lie, they have masses and numbers, but they are being followed by children, school children. And these are school children that we said, because they are not at home and they are not in school, why can't we bring them as government where we can monitor in phases? Because, as she said, the curve has not flattened.
Yes.
We have not defeated coronavirus, but we have at least managed the disease. And this is what we are calling the flattening of the curve, not the flattened curve.
Okay.
It is the flattening of the curve.
So
and
it's in
flattening
process.
of the curve was defined to be, yes, is in the process and was defined to be 4%, 3.5 to 4% consistent of 14 days. When we reopened school on 12th of October, we realized that the curve had started flattening. It had not flattened. I think I need to be extremely clear so that our listeners may get us clear and get the logic of reopening.
Okay.
So we said, because yet we are not out of the woods, we can bring these children back to school in phases. And then we determined the criteria. We said, we will bring the transitional classes. The transitional classes are Form 4 so that they can transit to the next level, Class 8 so that they could transit to secondary school, and then Grade 4. But people are asking, Grade 4 are transiting to what? The question is right. Grade 4 is a pioneer class for CBC, the competency-based curricula. And this is a class that shall seat junior secondary school, that shall be the junior secondary school in 2023. So these are the people we said, bring them so that they can go ahead and open the way when we return fully. And this full reopening was slated to happen perhaps 2 weeks after we reopened. But then we realized that COVID-19 is surging forward. There's a new reinfection. You have seen that Germany is proposing close down.
Yeah.
You can see France is happening.
Belgium,
you can see Belgium. So what we are saying is that we are not isolated in a corner of ignorance as a country. We are watching the global affair. We are watching the trend. But we are saying as government, we must go on. Our children are not a threat. Let me put this to you so that I can also give you time to put on.
Okay.
Our children, and you have seen Tononoka and other places in Nandi and Kisumu, a teacher has died, two teachers have died, and condolences to them. Some children have succumbed to disease, but they have not died. Rather, they have been infected.
Right.
This is not a danger to our children. Our children' greatest danger is their parents and guardians. Because we are taking care of them in school. Because we have put clean, drinkable, safe, and reliable water. We have put sanitizers. We have put temperature gauges. We have done everything possible to put our children in the best health standard. But their parents are the one going out there to drink, singing, what was that dance?
Jerusalem.
Yes, they are there playing everywhere. Then they are going to these marketplaces.
If we look at the situation that we have put these particular children in,
yes,
some children obviously are in Mombasa, but they live in Nairobi, so they had to be transported to their schools in Mombasa.
Yes.
The Nandi that you've mentioned, Kericho and all these other places.
Yes.
Don't you think that we carried infections from all these counties and literally spread them out? Because
our children,
kuna wanafunzi wako hapa, but they study in Turkana.
Let me answer your question, and it's a very good question, because now that one brings us to where the government is very confident of the efforts we are taking. All our children who are readmitted back to school, and that is boarders. You're talking about boarding students, because if they are in Nairobi, then they are boarding if they are outside Nairobi.
Sure.
They were as healthy as that word can get. We took measures. Every school took measures to ensure that the children were safe as they came in. And you know, even if one was sick, let me put it to you, even if one was sick or two, it was not a cause for alarm, because it is not a crisis for our young people. It is not a crisis at all, because they are asymptomatic. Most of them are even if you tested them today, you'll get nothing. Perhaps you test them tomorrow, you get something, following day, you don't get anything. It is not a danger to our children. The danger is to the teacher who is above 58 and the parents who are at home. So the government is 100% confident that our school, which is the environment of learning, was made safe for our children. My prayer and my cry, and I will ask the senator, because she has a better voice in the Senate, please do something against these political rallies. We can do nothing about it as ministers of education. We can do nothing except ensuring we are not doing the same. Our children are coming to school safe, going back home only to find the parents have transported the disease from the marketplace, from the bars, from all these places of pleasure. We are praying the parents to help us keep the child safe, because as government, we have done the best. Yes.
I will ask Stephen, you've heard what the senator has said.
Yes.
Basically saying that politicians are to blame for what is currently going on. You've heard what Mr. Zaki Nokia has said, the CAS. As an analyst, what do you make of this particular information? Because I feel like there's a lot of blame game going on, but no one is taking responsibility.
And it's very sad, because you see, the reality is the country has already been set for the last 6 months on a political trajectory, being BBI, being all manner of things that people are preparing for 2022. There are by-elections which are actively being slated for December the 15th. So the country is in a political mood, whether we like it or not. And there are gatherings that are happening and things like this that are happening. I think it is a quagmire, especially for somebody like the president, who has to sit down and balance all these interests, because the people themselves want to continue gathering, continue having discourse on things that matter to them. BBI is a national conversation that matters about, it takes a toll on what happens with their daily lives going forward. So you wouldn't blame Kenyans for showing up at rallies. You wouldn't blame them for showing up at gatherings whereby they need to hear and listen to their leaders. Remember, we had a lockdown that made people not listen to their leaders only via television, and not everybody had a television at the time. So you wouldn't be surprised why Kenyans are congregating and coming into these political gatherings. But the responsibility remains with what Senator Kasanga said. If I call you for a rally, make sure that I have made every single provision to actually ask you to stay in a manner that encourages social distancing, and encourage you also to wear your masks and even be in a responsible setting when you're at that particular political rally. We have not seen this. We have not seen this, whether it's a president, whether it's the deputy president, whether it is the Raila Odinga or any other political leader who has held a rally in this country. And these are the things that we need to have a national discourse on, because I do not believe for any one single reason that we will end up not doing these political gatherings. They will happen one way or another.
We should ask the politician in the House, Mheshimiwa Kasanga, if you've heard what Stephen Mwekesi has just said in regards to the rallies and so on and so forth. You being a politician, loyal to a party that is, championing for the BBI, what would you advise your party? Would you tell them not to attend these rallies? Would you tell them not to hold rallies? Because at the end of the day, I feel like the buck stops with you.
Yes, you're right, Paul, on that one. And in fact, us as Wiper have been very clear that we are not going to hold rallies at this time. If anything, my party leader has gone round to open up offices in various counties, because we want to have some presence in the entire country. So we are very clear that this is not the time to hold rallies. And even when people gather to listen to it, because somehow people just tend to gather when they see our leaders, we are very clear to tell them, can you please maintain some social distance? It has to be the responsibility of the person, of the leader who is addressing people, to take that responsibility. And honestly, I want now the national response team also to come out, guns blazing on this issue. There is a directive that was given that all public rallies will require permission. And, we've seen, yes, there's now permission being given. So again, this is by compliance of government that these public rallies are happening. But why are they not holding account, the leaders, once they give them the permission, that then they must adhere to some basic protocols. Churches are trying, some churches are not trying. And again, everyone, even in the schools, it's been very clear the protocol of opening school requires that certain basic protocols of COVID must be observed. So when a politician is given, or a political party is given permission to hold a public rally, why is there no adherence to protocol? It should come, that license or that acceptance should come with very clear conditions that you must hold this way, or this way, failure to which we shall not grant you permission again. That's what I'm wondering. Why is the national response team having a back seat when it comes to politicians? I would like something more done, honestly.
All right. So what I was actually asking is, would you as a party, I don't know if you can act as a spokesman right now, but would you as a party decide that whatever happens in regards to the BBI reggae, you wouldn't be a part of if it's going to put people at risk?
I am not the spokesperson of WIPA.
All right. You know what?
But I have been very advising my party as chair of COVID. There's no way I'm going to appear in a rally as chair of COVID ad hoc committee where the regulations are not followed. So I have been very clear and very vocal on that issue. And even now here, when we are discussing the BBI here at Rift Valley, we're also, cautious to say, this is yes, we want to sensitize the BBI, but we will have to look for other different mechanisms of doing this thing. Public rallies may not be the way to go. Yes. Okay,
Mheshimiwa, we're taking a short break right now. When we come back, of course, we shall look at what the president is going to be discussing on Wednesday with the entire government and the county governments, whether we're going to have a second lockdown, which is even tougher than the first one. And of course, our question of the day. Let us know your thoughts. Now, is a second national lockdown the solution to the rising cases of COVID-19? Is a second national lockdown the solution to the rising cases of COVID-19? Right on your screen is our WhatsApp number. Let us know your thoughts. We'll be right back. Hussein Mbali Nasi.